Hey y'all, so let's talk about the difference between joint pain and muscle pain when it comes to your low back. I know and you know that what you really want to know is how far can you push it? How much can you get away with before it really becomes a problem? Because our lifestyles are so go, 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 go that ain't nobody got time for that. So let's talk about the differences in what your body will feel when it comes to one or the other. So please remember that when it comes to the joints, bone, we know that bone has a rejuvenation rate of about every 10 years, but cartilage and particularly the discs in your lumbar spine, you can't really get those back. So we want to make sure to preserve these because there's no remaking these. There are invasive surgeries that you could go about, but it's never the same. So if you can keep your original parts for as long as possible, let's do that. In regards to your joints, in low back. So let's looking at the low back. So for joints, we're looking at the vertebrae, right? We're looking at the vertebrae, we're looking at the discs, we're looking at your sacrum, we're looking at your pelvis, and we're paying attention and making sure to preserve that. Now, when you have pain there, what you'll experience, you'll have, first of all, most people think of nerve pain, right? They think of sciatica. Now, I will tell you, there is a muscle guy that will cause similar symptoms to sciatica. Always remember that you cannot be diagnosed with sciatica without an image. And I say that because I've heard a lot of people say, oh, I went to the doctor and they said, oh, you're just having some sciatica. And they're calling sciatica like it's the symptom instead of sciatica as a diagnosis. See, I would call sciatica a diagnosis. I would not call it a symptom or a sign or symptom. So if you're getting that nerve pain, right, usually it's down the back, down the leg. If it's true sciatica, it's going to go to the foot, okay? If it doesn't go all the way, there's a chance it could be muscular. You still got to get it looked at. I can help you with that. You still got to get it looked at, but there's a chance it could be muscular instead of a true problem at the joint. And so remember, if you're having sciatic symptoms, you need to get an MRI to have proper imaging and really know if that's what's going on. Because that's the only thing that'll tell you, oh yeah, there's the disc. An X-ray, you see a little bit of imaging, but that MRI really shows the whole story. Think big picture versus little picture, right? Okay, so joint pain. You're gonna have incredible stiffness. That pain is typically gonna be pretty sharp. You're gonna feel like you can't move very well. Particularly towards the end of the day, it's gonna feel worse when it is a joint problem. Also pay attention to your medical history. Like if you know that you have a history of a bulging disc or a herniated disc, and let's say it hasn't been a problem in years, but then maybe you decided to move. Congratulations, but you moved furniture and now you're hurting. There's a chance that it could be that disc if you've already have had a medical history. So those are things that you would pay attention to in regards to joint pain. Now, if it's muscle pain, we still want to look at your medical history. If you have a history of pulling a muscle in your low back, then that muscle's been compromised. It is going to be a little susceptible to possibly getting torn again. Know that there is a big difference though between a sprain and a strain. So a sprain is going to be a tear that's actually in the muscle tissue, the muscle belly itself, whereas a strain, kind of in between the two, it's literally what attaches the muscle to the bone. So a strain is going to be a tear that occurs in the tendon. The healing journey for that takes a little bit longer, and typically it's never the same in the sense that it always tends to be slightly hypermobile in that area, which can make it more susceptible to injury. Now, when it comes to muscle, because muscle is active, if we have a skeleton standing here, it's going to be a pile on the floor because without all these muscles, tendons, and ligaments that are holding it together, it's a pile on the floor. You get your whole body out of this. And so the muscles have a huge availability and capability to adapt, to grow, and to change. And so making sure to utilize this is huge in your recovery. So if you've had a history of pulling a muscle, you have the opportunity to adapt and change that and to make it capable of doing the same activities that used to hurt it and to make it capable of doing those things. So that's really encouraging. Another thing that will happen if you are experiencing pain in the muscle is going to be that you notice throughout the day that it actually feels better. So getting muscles moving, if you notice towards the end of the day, you're like, oh, it's starting to feel good. Now, if it's just getting fatigued, that's one thing, right? Because if a muscle's been compromised, it's going to get tired a little bit faster, and that's okay. But if you notice that movement actually helps the lower back area feel better, then it most likely is muscle related. Again, that's a good thing because it's fixable. And you know what, something I didn't mention when it came to joints is going to be the dull ache. If you get that constant dull ache, usually that leads towards degeneration or arthritis, which means you're not getting very good movement in those joints. Remember, arthritis is like rust to the joints. And so if they're not moving very well, they're not well lubricated, then we've got to figure out how we can use these guys to get these guys moving, so that way they're nice, happy, friendly, and working better for you. So if you've got more questions, give me a shout. Love you guys. Thank you so much for joining, and if you found this content useful or helpful to yourself or with a friend, please feel free to share it, follow us, and of course you can find us on other social media platforms at Trainer in Pink. Love you guys. Mwah. Bye.